Hello everyone, and welcome to another episode of Retina Roundup. I am Dr. Mayur Chaudhary, Fellow in Vitro Retina and Ocular Oncology, and I am bringing you this month's top 5 articles. The first article we are looking at today is Drainage Retinotomy is a risk factor for surgical failure after pars plana vitrectomy in patients with primary uncomplicated rheumatogenic retinal detachment based on a retrospective study. This study analyzed 519 eyes which underwent pars plana vitrectomy and concluded that avoidance of the drainage retinotomy during small gauge pars plana vitrectomy in patients with RRD may lead to better surgical success and less frequent epiretinal membrane formation. Moving on to the second study, which aims to evaluate whether vigorous physical activity can be a risk factor associated with active central serous chorioretinopathy. In this case control study, the participants were enrolled in two groups. One group included 105 consecutive patients with active CSCR and other included 105 comparable control group of healthy participants. Moderate to high vigorous physical activity was observed in 63.5% of the patients with CSCR and in 26% of the controls. This study concluded a significant association of vigorous physical activity with CSCR, indicating an increased probability of disease by 5.5 times, probably due to hypertensive episode that it entails, which can break the precarious hemodynamic balance in the choroid of individuals predisposed to CSCR. Moving on to the third study, our third study aims to compare clinical outcome of 13 patients with optic disc pit maculopathy who underwent different surgical approaches. All the patients underwent standard pars plana vitrectomy, PVD induction, and gas tamponade. Endolaser to the temporal margin of the disc was done in 8 cases, ILM peeling in 9 cases, inverted ILM flap in 5 cases, and stuffing of the pit with ILM in 3 cases. The study found that not performing ILM peeling and doing endolaser were associated with better visual outcomes, concluding that all these surgical techniques are safe and effective, and vitrectomy with endolaser was good option for management of optic disc pit maculopathy. Moving on to the next novel case report, which observed annular choroidal detachment following intravitreal aflibercept injection in a patient with nivolumab treatment. In the report, a 58-year-old male with ARMD was injected with intravitreal aflibercept, following which annular choroidal detachment was observed. It seemed to have appeared due to enhanced inflammation by intravitreal injection. The patient had a history of stage 4 paranasal cavity cancer and was treated with nivolumab, which is an immune checkpoint inhibitor. The immune response might have been enhanced due to the use of nivolumab, so that intravitreal injection triggered inflammation, which was then treated with subcutaneous injection of triamcinolone acetonide, concluding that clinicians should be aware of this potentially associated immune-related adverse effect in patients on such immune checkpoint inhibitor for various cancers. Our last study aims to identify and characterize ocular adverse events that are significantly associated with anti-VEGF drugs for treatment of neovascular AMD. This study retrieved a total of 10 million adverse effect reports from FDA Adverse Event Reporting System, with 20,836 for ranibizumab, 19,107 for aflibercept, and 2,442 for brolucizumab. The study found out association of macular ischemia and RPE tear with ranibizumab, raised intraocular pressure and endophthalmitis with aflibercept, retinal vasculitis, retinal artery occlusion, and dry eye with brolucizumab, concluding that use of anti-VEGF drugs should be based on patient's underlying or present medical condition to reduce any adverse event associated with the treatment. That's all for this month. See you next month with new and interesting 5 articles. Thank you.